Podcast 5, Value-Based IQ. So Larry, I understand that your organization has developed a program called Value-Based IQ. Can you tell us about it?
Yeah, we're really excited about this value-based IQ program. We actually developed the program last October, submitted it for a trademark patent, and were approved last month with the United States Patent and Trademark Office for this value-based IQ program. No one can use that name but us. We own the name. But it's a unique practice assessment program tool to position our physicians and their practices as a high-performing, in-demand physician group. And when you say value-based IQ, well, on a scale of 1 to 10, through practice assessment, a physician practice can be rated as a high-performing, engaged practice with a high-rated value-based IQ of up to 10. The goal of all these practices and our practices should be to have a value-based IQ of 10. But how does a practice obtain that value-based IQ of 10? Well, as healthcare moves from fee-for-service to fee-for-value, physicians that are transitioning their practice to higher quality, low-cost providers will be the in-demand physicians with the patient consumer, the employer, and the payer. And it's, as I mentioned earlier, it's projected that 50% of physician reimbursement in the future will come from value-based programs. So what are the 10 bullets that we have developed and quantified with documentation behind it to go through this? Well, let me kind of go through each one of them. The following behavioral factors and their staff will indicate with one bullet for each factor whether they in fact are qualify for this and get that point in their IQ scale. The first one is an educated physician and staff on a patient-centered approach to total care. That's where it's all about team-based care today. It's about the patient. It's not about anything else, but the patient is the total center of care. The second one is so how do we quantify that within the physician practice? The second one is understanding quality metrics and gaps in care methodology and having a plan in the office to execute and do that to the highest possible capability. The third one is having an engaged and knowledgeable staff centered on providing the right care at the right place at the right time for an appropriate cost, and referring to quality, cost-effective specialists and ancillary providers, not just old friends and favorites that they've been referring to for years that are not cost-effective and not high quality. So it's about behavioral modification, really, and we help them do that. Open communication with their patients. Are you accessible versus your patients just going to the ER after hours? Do you have an assigned hospitalist for inpatient care of your patients to make sure that you know what's going on with your patients? Because you may spend 15 minutes a quarter or 15 minutes every 3 or 4 or 6 months with a patient. 99% of what happens to the patient happens outside the physician practice. What are you doing to make sure that you have control of that with your patients to assist them? That's very, very important. Do you have a plan in assessing and reviewing complete patient data for total population health management? And there are so many different acronyms out there today in healthcare. You've got MIPS, you've got the MACRA, you guys may know what that is, the alternative payment models, ACOs, accountable care organizations, Medicare Advantage, MSOs, managed service organizations. You got all these different things, and the MIPS is merit-based payment incentive program under MACRA, which is one of the two arms. The other one is the IPN model. So do you understand all that? Does your staff understand it? And are you able to function within that? Because in reality, there are a lot of revenue to be be acquired there by just taking care of your patients in a more appropriate manner and meeting these quality metrics that all these payers require. Are you competent in risk coding, Very important in the Medicare world. And do you review and understand the quality metrics that are required to achieve shared savings for your practice? And we go through what we call hierarchical condition coding, HCC coding, and it's called Medicare risk adjustment. And April works on that. She's a coder as well. And then we deal with things like star ratings. Star ratings is a performance-based program for a Medicare Advantage plan, a Medicare HMO. And we run over 4.0. 5 is the top. And the reason that that's important is not only does it generate revenue star performance bonuses for the doctors, it also identifies each HMO, like Cigna or Blue Cross, as a high-performing Medicare Advantage plan. And if they get a 5.0, which 3 of our plans are this year, that means they don't have to just market them during the open enrollment period of October 15th to December 7th. They can market during the entire calendar year and add lives. That's super important. And then HEDIS gaps and performance standards, it all plays into, in other words, did you quantify an A1C? Did you put it in your EMR system for a diabetic? Are you identifying the other comorbidities with diabetes or hypertension or coronary artery disease or COPD or any of these things? And then chronic care management. Do you have a chronic care management approach and a plan for your patients outside your office visits? And again, that's so important with telemedicine coming in today, with remote patient monitoring. April and I just had a big meeting with a group yesterday that we're rolling out a remote patient monitoring program, and that's going to be part of our value-based IQ. But really the whole purpose of the value-based IQ program is so that the physician knows their physician scorecard from all their payers, and they engage an action plan to improve their practice so that no matter who the payer is, whether it's a self-insured employer, it's Medicare, Medicaid, or commercial, that they're a demand practice, that payer says, I have to have that physician practice in my group because of the quality and the cost effectiveness of the practice. That's really what value-based IQ is all about.
Wow. Well, April, let me ask you this. So how does the value-based IQ change how physicians practice medicine?
Well, I think, like Larry mentioned, it really gets them to clue in on what they need to focus on in their practice in order to have their performance be even better. So again, it does reflect in their commercial shared savings contracts, their Medicare Advantage risk contracts, whether it's direct to employer health benefit program, the value-based approach to healthcare in general. I think it's definitely moving that way. 50% of physician reimbursements are going to move to a value-based reimbursement. Like Larry said, we are moving from fee-for-service to fee-for-performance. So value-based IQ is it's another tool that we want to provide to help the physician practice hone in on where they may have deficits, how to improve those deficits, get their IQ up to a 10 so they are that high-performing in-demand practice. Overall, it's better patient care, it's a better work environment for the physician and their staff because everything is moving smoothly through the practice. I think overall it's just it's a great approach to healthcare today.
You know, every time a payer, like one of the big 4, Blue Cross, Cigna, and United, every time they develop a network for any plan design that they come out with, they do what they call a scope and assessment on all their physicians. And that's where this value-based IQ with the numbers on their stars, their HEDIS, their quality metrics come into play, and they see that, wow, they are what they call a high-performing in-demand practice, and they're always included in these networks.
So those 10 points that Larry just reviewed, that really gives you 2 huge areas that we look at, which is their total overall medical costs and their total overall quality, right? So we want to improve the total medical costs and the quality by actually reducing the costs and improving the quality. And those are just 10 simple ways to guide them into that area in order to be able to improve.
So you keep talking about the value-based care. How will it financially enhance the physician practice and the patient consumer?
Yeah, it's all about shared savings and surplus dollars. In other words, in our Cigna contract, which we're in our 4th year, our docs still bill and collect under their own Cigna individual contract all year long. But then we've made almost $1 million in the first 3 years in shared savings for our doctors, over and above what they bill and collect, because of these performance initiatives based on both cost and quality. And it's the same thing in the Medicare Advantage world. It's the same thing in the commercial world and in the self-insured employer world.
Wow. So how would you summarize this message?
Well, I think overall, it's total medical costs and quality. Medicare has already proved it in the ACA model. Preventative care is the way that we're moving. And so physicians are gearing themselves to do a lot of assessments on that preventative type of care. Females over the age of 40 get a mammogram. Men over the age of 40 need to get a PSA, but we'll talk about that later. Just these different things. If you're diabetic, you need to have an eye exam. The physician not only has to perform these services to make sure they stay ahead of a condition that could turn into an acute issue, but they also need to educate the patient so that the patient understands. Because we have a lot of diabetics in our community, let's face it. But do they know if they don't get that diabetic retinopathy every 2 years that they could in fact lose their vision? You know, I don't think unless they hear that from their physician, they really give it the value that they need in order to get that screening. So it really is that education, but from taking it from that preventative healthcare approach to increase the quality and decrease the costs.
Yeah, I think in summary, the value-based IQ program does 2 things. As an administrative arm, it identifies to us which physicians need the most help in getting to where we want them to be from a value-based. But then on the second side, it will help physicians know their own personal scorecard and from all the payers, and help them know how to put a plan in action to improve their performance overall. And that is the main purpose of value-based IQ.
What great information. Well, thank you so much for educating us.